Good day. I am Dr. Irene Chico, and I am here to present the steps in doing abdominal examination in a pregnant woman, particularly how to perform the symphyseal fundal height and the Leopolds maneuver. The following are the steps. Wash your hands and don PPE if appropriate. Introduce yourself to the patient, including your name and your role. Confirm the patient's name, and briefly explain what the examination will involve using patient-friendly language. For example, today I need to examine your tummy as part of the assessment of your pregnancy. This will involve me looking and feeling the tummy, in addition to performing some measurements. Although it may be a little uncomfortable, it shouldn't be painful. If at any point you'd like me to stop, then please just let me know. You should also gain consent to proceed with the examination. Make sure to always provide comfort and sense of privacy. Position the patient on the clinical examination couch with the head of the bed at a 30 to 45 degree angle for the initial assessment. Adequately expose the patient's abdomen for the examination from the pubic symphysis to the syphis sternum. Offer a blanket to allow exposure only when required. While exposing the patient's abdomen, you should be able to note the presence of linea nigra, any changes in the skin pigmentation, or any scar from previous surgical procedure, if any. Provide the patient with the opportunity to pass urine before the examination. Ask the patient if they have any pain before proceeding with the clinical examination. Now let us proceed with the symphyseal fundal height. This is the distance between the fundus and the upper border of the pubic symphysis. To measure the symphyseal fundal height, first we begin with the palpation of the abdomen just inferior to the syphis sternum using the ulnar border of your left hand. Locate the fundus of the uterus. There is a firm feeling edge at the upper border of the bump. Once the fundus has been identified, locate the upper border of the pubic symphysis. Then measure the distance between the upper uterine border and the pubic symphysis in centimeters using a tape measure. The distance measured should correlate with the gestational age in weeks, plus and minus 2 cm. To avoid bias, it's best to place the tape measure facing down and only turn to view the numbers once in position. Now let's go to abdominal palpation using the Leopolds maneuver. Abdominal examination can be conducted systematically employing the 4 maneuvers described by Leopold in 1984. The mother lies supine and comfortably positioned with her abdomen bared. The first maneuver, also called the fundal grip, assesses the uterine fundus to determine its height and which fetal pole, that is, cephalic or podalic, occupies the fundus. The uterine contour is outlined by the examiner, placing both of his or her hands on each upper quadrant of the patient's abdomen, facing the maternal xiphoid cartilage. Using the fingertips, the fundus is gently palpated to identify which fetal part is present in the upper pole of the uterus. The breech gives the sensation of a large nodular mass, and its surface is uneven, non-ballotable, and not very mobile, whereas the head feels hard and round with smooth surface of uniform consistency, is very mobile and ballotable. The second maneuver, sometimes called the umbilical grip, involves the palpation of the lateral uterine surfaces. The examiner stands on either side of the bed and faces the upper part of the mother. It is accomplished as the palms are placed on either side of the maternal abdomen and gentle but deep pressure is exerted. On one side, a hard resistant structure is felt at the back. On the other hand, numerous small irregular mobile parts are felt the fetal extremities. After locating the fetal back, next is to determine or count the fetal heart tones using stethoscope or the fetal Doppler. The third maneuver is performed by grasping with the thumb and fingers of one hand the lower portion of the maternal abdomen just above the symphysis pubis. Here you are standing still on either side of the bed and faces the upper part of the mother. If the presenting part is not engaged, a movable mass will be felt, usually the head. The differentiation between head and breech is made as in the first maneuver. If the presenting part is deeply engaged, however, the findings from this maneuver are simply indicative that the lower fetal pole is in the pelvis and details are then defined by the fourth maneuver. The fourth maneuver resembles the first maneuver. However, the examiner faces towards the maternal pelvis. This maneuver involves the examiner placing the palms of both hands on either the side of the lower abdomen with the tips of the fingers facing downward toward the pelvic inlet. Palpation of the bilateral lower quadrants to determine the engagement of the fetal presenting part. If the fetal part is engaged, examiner's hands diverge. If fetal part is not engaged, examiner's hand converge. If the fetal head is felt on the same side of the fetal back, fetal head is well flexed. To complete the examination, we should explain to the patient that the examination is now finished. Don't forget to thank the patient for their time. We should dispose the PPE appropriately and wash hands and summarize the findings. Thank you.